Achievement. Family. It's about belonging to a vibrant community that strives for greatness in everything. Being a Longhorn means engaging in STEM education, starting your path to college in elementary, and earning a college degree in high school. Being a Longhorn is a choice to lead, to innovate, to thrive in any setting. Here, you'll discover that learning isn't limited to textbooks. We believe in hands-on experiences that ignite creativity and fuel imagination. As a Longhorn, you have the opportunities to grow beyond the classroom, from the stage to the field. It's a great day to be a Longhorn. And when the time comes to graduate, you'll leave with a sense of accomplishment, knowing that you're prepared for whatever the future holds. The pride of being a Longhorn is something that cannot be described. It's better to experience it and feel it. This is Cedar Hill ISD. We educate, empower, and inspire.
Good afternoon, Longhorn family. My name is Carla Settle, and I proudly serve Cedar Hill ISD as your Chief Financial Officer. Today, I am joined by my team, Paula McBride, our Executive Director of Finance, and Kathy Shaw, our Benefits Coordinator. I just want to thank you for joining us today as we broadcast this town hall meeting to share options for next year's medical plan benefits. These rates are hot off the press after arduous work by the business office, staff members, our medical plan consultants at Higginbotham Public Sector, and the Benefits Committee. Speaking of the Cedar Hill ISD Benefit Committee, this group of employee advocates felt very strongly that this process include the entire Longhorn family as they wrap up their role. It was requested that a survey go out to ask your opinion about our medical plan benefits options after this broadcast. All of this information will be shared with the Board of Trustees at the June 3rd board meeting, including the results of this survey. The survey will stay open until next Friday, May 31st. And before we proceed, I'd just like to personally thank the Benefits Committee for tuning into all the meetings that started way back in April and spending their time consuming the immense amount of information when it comes to medical plans. So right now, I'd like to introduce Braun Cattle and Christine Adams from Higginbotham Public Sector to review our options available to the Cedar Hill ISD employees for the 24-25 school year.
Thank you, Carla. It's a pleasure to be here this afternoon, and I tell you, I can echo some of Carla's comments that what a testimony it is that you all are here on the Friday afternoon of a long holiday weekend to discuss something that is as important as your health plan coverage for Cedar Hill employees for the 24-25 plan year. When it comes to your family's monthly budget, it hasn't been that long ago that monthly health insurance rates surpassed what a typical car payment is in the family budget every month. And quite often we're seeing that it is approaching, in many cases, the monthly mortgage payment for your monthly budget. And it's just extremely important. And so before I get into the presentation today about the plans, I just kind of want to share with you a little bit about what is going on in the healthcare marketplace and what is happening and what we are seeing when it comes to rates across all carriers. Back in 2020, when probably March of 2020, when COVID really started to take hold, we really had about a 2.5 year period up until about halfway through 2023, halfway through last year, where the world was just focused on COVID and medical facilities were filled with COVID patients and folks that needed to have elective medical procedures done, put them on the back burner. They put them on the back burner because, number one, they couldn't get into a hospital, or number two, if they could get into a hospital, they didn't want to be in a hospital full of COVID patients. And so for that 2.5 year period, we really saw not a lot of elective procedures. The surgeries, the neck surgeries, the elbows, the shoulders, the digestive, whatever it was, just kind of got put on hold. Well, then what we saw about last year and even up into this year, 2024, is all of those things that got put on the back burner, we have all been getting those things taken care of. And so what we have seen in the last 12 to 18 months is just an unprecedented utilization of health plans, not just within the 90-degree benefit plans, but really across the board and among all carriers. And so as you all have been reviewing the options and the benefit options, and you're seeing what has happened to those rates, that is really what is driving the rates across all carriers. And it is just that utilization of the plan. And we're in one aspect, we're proud of that we have offered you plans that you can afford to use. The downside of that is it really drives up the cost of claims. And so what we're going to cover today is, I think we've got some good options for Cedar Hill ISD for the 24-25 plan year. As Carla mentioned, I'm joined this afternoon by my colleague Christina Adams, who also works with us in the program. And so we're happy to be with you all here today. One of the things that I wanted to start with was let's look at your current enrollment at Cedar Hill ISD. And right now, of the employees that are in the health plan, you have a total of 541 members on the health plan. 461 of those members are currently enrolled in a directed care plan, one of the plans that you reach out to the care coordinators when you need assistance. Um, 295 of those are on the directed care copay plan, and 80 of those are on the Aetna PPO plan. And I like to cover this, and you can kind of see there on the graph of how many of those are employee only or employee plus children, family coverage. Um, and that becomes important because as you're looking at options, it's important for us to talk about, and we will a little bit later in the presentation, about what we call migration. And that is if plans are changing at renewal, or if you're looking at utilizing another carrier, where we think employees are going to migrate under the new plans or under the new carrier. So first, I want to review the 90-degree benefits plans that you all have been looking at. Um, One of the things that I like to make sure that everyone knows is that with the 90-degree benefit plans, the Cedar Hill team, when you have something that is not working right, or when you have a problem or an issue, Kathy and her team, they have an assigned 90-degree benefit account executive and an account specialist that they can reach out, that they can contact, that goes directly into the Care Connect Care Concierge team when you all have issues. And one of the things with health insurance, your need to access the benefits of your health plan don't just happen 8 a.m. to 5 p.m. Monday through Friday. And one of the things that the 90-degree benefit team is that the account team is very proud of is that they make themselves highly accessible to the district and to Kathy and her team to be able to help employees out when they need assistance, even on the weekends and in the evenings. And so they're an important part of the equation as you are looking at different options for the coming year. Additionally, the 90-degree benefit plans come with prescription support teams with Lavinity and RX Compass. That's an important aspect of the 90-degree benefit plans because, as you all know, we have a number of Cedar Hill employees that are taking those high-cost specialty medications. And we are quickly seeing the cost of prescription drugs is fastly approaching the cost of hospitalizations when it comes to claims expenses on the medical plans. And so having a dynamic RX delivery system that you have access to, that your team has access to at Cedar Hill, to help to control those costs, but more importantly, to get you the prescription medication that you need is an important component on the 90-degree benefit plans. Just some reminders, the plans on 90-degree benefits do not require you to select a primary care physician. And they also offer out-of-network benefits. Two big key components. I know when many districts left TRS Active Care years ago, that was one of the driving forces of their decision to leave TRS Active Care, was that I don't like the fact that I have to name one primary care physician, and if I need to see a specialist, that I have to have a referral to see that specialist. And so, just as it works today on the 90-degree benefit plans, you do not have to select a primary care physician, and you do have out-of-network benefits. The plans are going to continue to utilize the Health Smart network, which that is a nationwide network, not limited to Texas only. So when you're traveling, or if you have kids that are in college outside of the state of Texas, that Health Smart network has providers in all 50 states. Um, the plans will continue providing the quality care with the currently contracted hospital systems and providers. And one of the things that the 90-degree benefit team does is they are constantly looking for additional hospitals, additional hospital systems to contract with and to secure those agreements with, to ensure that you have access to the best facilities. Um, we know that there are some hospital systems, and the Dallas area has one of those that just is very difficult to negotiate rates, not only with 90-degree benefits, but with all health plans. And so, but that doesn't mean we quit trying. We always, the 90-degree folks do a great job of working with hospitals and hospital systems to secure those contracted agreements. Um, One of the changes to the 90-degree benefit plans for the 24-25 plan year, um, when the plan was started in 2020, it's been a risk pool, and so Cedar Hill employees were kind of pooled with districts from around the state to contribute to the plan, and then claims were paid from that risk pool. New for 24-25 is each district's going to be on their own, and the rates that you have in front of you are for a Cedar Hill plan. One of the things that is is important is when it comes to savings, cost savings, rebates from pharmacies. Those savings now will be passed on to the district, and those rebates will become part of the district versus coming to the pool as a plan. The 90-degree benefit plans will continue to offer telehealth. We have a lot of good response on the Teledoc program, and a number of you are using the Teledoc program. And I know for myself, I don't really care to go and spend time in the doctor's office waiting room and then be called back to a exam room and sit there for another 20 or 30 minutes. So you'll still continue to have access to telehealth. Those additional benefits that are provided for members at no additional cost are the Virta Type 2 Diabetes Reversal Program, as well as the Hinge Health Musculoskeletal Pain Program. And I know a number of Cedar Hill employees are taking advantage of both of those, and we continue to hear good feedback from you all on those programs, and as well as TSHB Fit, our wellness program that we like to have employees engaged in, and we're constantly working with our districts to increase employee engagement, because we know that a healthier employee results in claim savings to the plan, which again, beginning in 24-25, the plan will be Cedar Hill ISD. So that results in savings to Cedar Hill ISD. Um, because Cedar Hill ISD will own their plan, there is reinsurance that is attached to the information that you've been reviewing. And what you will see is when you look at that is that this is a level funded quote for the stop loss coverage with a 1224 contract. And basically what that means in layman's terms is that Under that stop loss reinsurance plan, any expense that is incurred in the 12-month period from 9/1 of 24 through 8/31 of 25 will be paid, and it will be paid for an additional 12 months through 8/31 of 26. Now you might ask, why would we do that? Well, doctors' offices are not real swift when it comes to billing for their services, and we are today receiving bills for claims for services that were rendered last year. And we know in the school world that many of you access medical care and you get those elective procedures done during June, July, and August when school is out. And so when you have a procedure that is done in August, more than likely the health plan is not going to receive that bill for payment until November, December, maybe even January. And so that extra 12 months for the 12/24 contract is a key component of your benefit package, because it allows for all of those claims that are going to be coming in for payment within that additional 12 months. Um, you'll see there that it says the proposal rates are quoted at funding to the maximum. And what that means is we have basically provided rates for worst case scenario for your claims. We don't like any districts to be surprised, or any no more surprises. And so that's what basically what that means, is that it's going to ensure that there are no shortfalls for the district next year. Of course, and the district will continue to receive the same support, not only from your Higginbotham Public Sector group, the TSHBP team, and the 90-degree benefit team. And the last bullet point, I guess we duplicated, because it's really important that those pharmacy rebates do go back to the district. And you're about to see why. So there are many of you that are watching this today, and that may be watching the video at a later date, that are taking advantage of the RX Compass program. And we have the 90-degree plans have a great pharmacy benefit with Lavinity. But for those of you that are taking those high cost specialty medications, the Ozempics, the Mounjaros, the Jardiance, any of those drugs that you're seeing advertised on the evening news or during sporting events that quite often can run $2,000, $3,000, $4,000 a month, the RX Compass program provides a path for those drugs to be sourced through alternative methods, whether it's internationally, which we see there that we have 73 claims for Cedar Hill employees are receiving their high cost specialty drugs through our international mail program with RX Compass. Patient assistance program, 32 of you, and variable copay, 90 claims for those drugs. And why that is important is that in the RX Compass program, when you are needing one of these life-saving medications that is very expensive, you have access to a navigator, an RX Compass pharmacy care navigator, who works with you to determine what is the best procurement method for that drug. And the beauty of the thing is that it finds that drug and gets that drug at little to no cost to the member and to the plan. And so on that prior slide, when I said those pharmacy rebates will now go to the district, when you see here that the pharmacy rebates for Cedar Hill ISD year to date at $230,627, those are pharmacy rebates that come back to the plan that next year, if you decide to go with the 90-degree benefit plan, will actually revert back to the district. So results in significant cost savings, not only for the plan, but also for you as a member. And again, I see we have a number of you that are on the RX Compass program that are a testament of how it works and how well it works at getting you these high cost medications at little or no cost. The second option that you're reviewing through Higginbotham Public Sector for the 24-25 plan year is a Blue Cross Blue Shield of Texas plan. Unlike the 90-degree benefit plan, which is a self-funded, level-funded plan that is owned and run by Cedar Hill ISD, this plan is a fully insured quote. It is extremely similar to what you had with TRS Active Care. You'll see in there that there are three plan offerings. There's a high deductible HSA plan. There's a $2,000 deductible Blue Essentials HMO plan and a $5,000 deductible Blue Essentials HMO plan. The HMO plans only do not offer out-of-network benefits, and they do require that you select a primary care physician, as well as they do require referrals for specialists. So work very similar to how your plans worked with TRS Active Care. There are two network quotes, and you'll see those: the Blue Choice and Blue Essentials, and then the Blue Choice and Blue Advantage plans or networks. The differences in the networks is important to know, as some of those are national. The HSA plan does offer a nationwide network. But for the most part, those are statewide networks, just like it was with TRS Active Care. And so important to consider if you are ever needing health care outside of the state, or if you have children that are away at college. Of course, they always have access to medical facilities for those emergency, the 911 situations that require them to get emergency care. But for regular medical service, being out of state can prove problematic. But just kind of keep that in mind. The plans also offer the additional benefits such as wellness and telehealth as the 90-degree benefit plans. But more importantly, it'll be important to note in your review in the package that there are some of those that are specific to the PPO plans. So as you're reviewing the different options, be sure and note those. Rates for that plan are firm, and again, it's a fully insured quote. There is no stop loss coverage, no additional coverage that the district is going to be responsible for. And again, the district won't own the assets of the plan like they would on the 90-degree benefit plans. You might see on there that there are some medical transition credits that are available to the district. And basically what that means is that Blue Cross Blue Shield will provide a credit to the district on their first billing for transitioning from one carrier to Blue Cross Blue Shield. So important to note, just wanted to point that out. So here is just kind of a spreadsheet that we've put together, the rates. In the gray box, it's showing your current plans. And I'm sorry, I have to look off to the side because my eyes are bad and my main screen is really small. Showing the rates for your current plans. And then the employee cost is in the second box below, comparing current plans to the 90-degree benefit, directed care plans to the PPO Blue Cross Blue Shield plans. So we wanted to do that, just kind of give you in one page, one screen, the ability to compare the cost and what that means for both plans. The next slide, this basically shows the comparison of the three TSHBP plans, the high deductible plan, the gold plan, and the silver plan on the top, and then your Blue Cross Blue Shield of Texas plans on the bottom. And we've stacked them above each other as that are the most similar. We've done the best that we could, and there are some significant differences among the two. But I would just encourage you, as you're reviewing those, when we talk affordability at HIG Public Sector, of course there's the monthly premiums. There's that monthly cost that comes out of your check. The second aspect of affordability is, what does it cost you to access your coverage? What does it cost you to utilize your benefits? And so I want to spend some time here just kind of going over that so you can kind of have a clear understanding of that. So first, we'll compare the high deductible plans from the 90-degree plan versus the Blue Cross Blue Shield Blue Edge HD plan. For the 90-degree benefit plan, your individual deductible is $4,500. Co-insurance on the 90-degree benefit plan, there is none. After you meet your deductible, then the plan pays 100%. That's why you see there that the individual out-of-pocket maximum is the same amount as the deductible. Once you meet that deductible, then eligible expenses are paid at 100%. Important to note here is that even on the high deductible plans, that your annual wellness visits, those annual checkups to your doctor, are covered at 100%, not subject to that deductible, and that is the same on both the 90 degrees and the Blue Cross Blue Shield plan. So you'll see there that after you met that deductible, everything is paid at 100%. The drug deductible is part of the medical deductible, so no additional drug deductible there. And then you can see the difference, really pointing out that on the prescription drugs for the TSHBP 90-degree plan, after your deductible, the plan pays 100%. On the Blue Cross Blue Shield plan, even after you meet that deductible, you still have a percentage of the cost of those plans, even on generics. Moving on to the 90-degree benefit TSHBP Gold plan, that has a $1,500 individual deductible. And this is most similar to what we call today our copay plan. It's adding a deductible for the 24-25 plan year, but that deductible only comes into play when you have an admission for a procedure, or when you have to go in to a facility to have a procedure done. You see there that you still have the copays to access your primary care physician, your specialist, urgent care and emergency room care, as well as hospitalizations. Maximum out of pocket on that plan for an individual is $6,000. And when on this plan, when we talk about the maximum out of pocket, because there is no co-insurance, there's none of that 20% or 30%. Basically what that means is if you have a year that you have paid $6,000 in copays, then the plan just begins paying at 100%. On the prescription for the gold plan, you have a $200 brand name deductible only. And for generics, $0 copay, and you see the participating pharmacies there, CVS, HEB, Walmart, Costco, Sam's, you pay nothing for generic drugs. $10 for all other pharmacies, and then you see the copays for preferred, non-preferred, and specialty drugs. Comparing that to the Blue Essentials 2000 HMO plan, that plan has a $2,000 individual deductible. After you meet that deductible, then the member is responsible for 10% of the bills until they have hit a maximum out of pocket of $6,000. And then that plan begins paying at 100% of eligible expenses. Again, no copay for preventive care. Virtual health, your telehealth is no copay. Primary care specialist, urgent care, and emergency room copays, you'll see are identical to the directed care gold pay plan. Drug deductible, this one has a $200 per employee deductible for all medications, even generics, not just the brand deductible. So that's a key differentiator between the 90-degree plan and Blue Cross Blue Shield. And then you have additional percentage copays for the generic, preferred, non-preferred, and specialty drugs. Lastly, comparing the TSHBP 90-degree silver plan to the Blue Essentials HMO 5,000 deductible plan. TSHBP plan, $2,500 individual deductible. Again, there is no co-insurance. You don't have any 20 or 30% to pay after that. You only pay that deductible again when you are going to a facility to have a procedure or need admission to a hospital or an emergency room visit. Other than that, you're paying copays for seeing your primary care physician, specialist, urgent care facility or emergency room, as well as access to the Teladoc telehealth service. On this plan, you have a $350 brand name only drug deductible. Again, $0 copay for generics at the participating pharmacies. $10 copay on generics for all other pharmacies, 45, 90, and 50% for those specialty drugs. Comparing that to the Blue Essentials 5000 plan, $5,000 deductible for an individual. After you meet that deductible, then you're responsible for 30% of the eligible charges until you hit an out-of-pocket of $9,100 for an individual. Excuse me. Preventive care again is $0 copay. Primary care, $45, specialist, $70, urgent care, $100. And then for an emergency room, there's a $500 copay. Plus, since they consider that to be an admission, you're going to have 30% coinsurance until you hit that out-of-pocket maximum. For prescriptions, you have a $250 employee drug deductible. That's for all drugs. So you're going to pay the first $250 of drug expense before you start paying the 10%, 50% copays for those plans. So again, we just kind of talk about here of what the blue plans are the most similar. The yellow plan and the green is the closest, and then the gray plan and the orange plan are the most similar. And as I said in the beginning, when we talk about migration, what an employee that is on the copay plan, which plan do we think they're going to go to? An employee that's on the Aetna plan, which plan do we think they're going to enroll in? And for the job that we do, that's one of the most difficult things that we have to try to figure out of where do we think those employees are going to move to. So that's all I have on that one. Let me mute real fast. I'm going to get a drink of water. Hang. Thank you. Got a frog right there today. Basically, we put this together for you all to really get an idea of the impact of the TSHBP plans that you are under this year, comparing that to the Blue Cross Blue Shield of Texas for 24-25. The second green box is just kind of where the first green box is where Blue Cross Blue Shield thinks that those employees are going to migrate to. Looking at, again, the plans that you're on today, where they think those employees, which plan they'll select at enrollment. The second green box is basically where we think employees that may, if Cedar Hill, if you all decide to move to the Blue Cross Blue Shield plans, where we think based on those benefits that are provided by the directed care plans, where we think you're going to migrate to. And the migration for the second blue box is identical to the blue box at the bottom. And that is where we expect employees that are currently on the medical plan with 90-degree benefits, given the fact that the Aetna plan is going away, where we think employees are going to enroll. And so we've taken that and we've extrapolated out all of the rates and what the cost is going to be to Cedar Hill ISD as a whole for the year. And so you'll see the total annual for the 23-24 plan year versus the annual for the Blue Cross Blue Shield, how they think employees are going to migrate, the total annual expense for Blue Cross Blue Shield, how our team thinks you all would migrate. And again, it's not an exact science, it's a guess. But then the bottom, the blue box, is how, based on the 90-degree benefits, the packages that are there, how we think employees will migrate. And so to get an apples to apples comparison, we're looking at the total annual expense for the second green box and the total annual expense for the blue box. Because that, as you'll see that the employee counts for there are identical among those two boxes to really give you a comparison of what the cost is for both of those plans. Um, but remember, when you're looking at that blue box, the district is going to be receiving any pharmaceutical rebates from the plan for the 24-25 plan year. That figure, the 4.492 million, does not factor in what those rebates are going to be. So that cost is actually going to be a little bit lower. And it's just we want to make sure and that we point that out for you all as you're reviewing all the plans to make a decision. And lastly, just some things that we wanted to be able to point out and make sure that you understand. When it came to benefit design, um, and these are just two plans. You all may be looking at other plans from other carriers. Again, when we talk affordability, it's not just strictly that monthly premiums that are being deducted out of your check. Really pay attention to what those maximum out of pockets are. Pay attention to what those deductibles are. Just like on the Blue Cross Blue Shield plan, having deductibles on prescriptions before you're able to begin paying those with copays. Pay close attention to that, as well as for access to care. Again, networks. Is there adequate network coverage? Is it Texas only? Is it nationwide network? And it's important to consider those things both on the medical side of benefits as well as the pharmaceuticals side of benefits. What kind of access, what kind of programs for those of you that are on the high cost specialty medications? What is your access going to be for those? If you're on the RX Compass program under the directed care plans and you are getting those high cost medications at little to no cost, what is that financially going to look like for you if you move to a plan that does not have a program for high cost specialty medications? So important to keep in mind, as well as the benefit plans and, like I just said, the premiums and your financial responsibility when you're utilizing the benefits. Um, and then also important, like I said, just in the last two slides, important to consider the benefit plan migration. And that's why at the first of the presentation, I gave you that breakdown of how Cedar Hill's enrollment is across the plans right now with 90-degree benefits, of how you think as you're looking at all benefit options, where you think you will move, but more importantly, where you think your coworkers and others that are on the plans would move, given the choice of what they want to do. So um, folks, I know that is a lot of information in about 40 minutes. Drinking a lot of water out of water hose, and it's a Friday afternoon before a long holiday weekend. But I am here, and Christina Adams is a wonderful part of our program here. And Christina, do you have anything that you want to add before we get to the questions? You're on mute.
You did such a beautiful job. I'm not sure I have anything to add. The only thing I wanted to clarify and didn't want to stop you, just doing such a great job. Pharmacy is a really big component. It's really important to a lot of our members. We've discovered that over the past few years. So I just wanted to clarify: the pharmacy deductible is a one-time deductible. I've had that question many, many times. Am I going to have to pay that deductible every time I get a brand medication? No, it is a one-time deductible. I think that's the only thing I wanted to clarify, Bron. Otherwise, did a terrific job. We're here to answer any questions.
Okay, thank you. All right, so questions. So Sherry Whitemore.
And I don't mind answering
Okay,
Sherry's question. It's actually a really, really good question.
that is.
The Mounjaros, the Ozempics, I think it's Trulicity, there's Jardiance, there's many, many medications out there that have become quite popular, including Wegovy and Zepbound, I believe. But they're become very popular because not only are they used to treat type 2 diabetes, but they have found to be a great way to lose weight. So those medications have become extremely popular. Um, One of the things, though, that are is required, right? The FDA has deemed those medications approved for type 2 diabetes. They've put actually Wegovy and Zepbound into a separate category of weight loss. But to access those medications like Ozempic and Mounjaro, you do have to meet those clinical qualifications for it, right? There's an authorization. You do have to show to have type 2 diabetes. And Sherry, please reach out to me. I'm going to try to find you and contact you because I find that a lot of districts, or not a lot of districts, but a lot of members sometimes don't always know how to navigate that patient assistance program that we have. I just recently helped somebody on your benefit committee to start receiving Monjano at a no cost to himself. So just reach out to me. We want to make sure that everybody knows how. We find education is key. But if you're not receiving it because clinically you're not showing to have type 2 diabetes, that is how the program pays for it currently.
Yeah, Sherry, if you don't mind emailing benefits@chisd.net, Kathy will make sure you connect with Christina pretty quickly. So that is one of the benefits that we've had this year is just that personal approach. And we've seen a lot more of our employees gain access to their care that way.
And Ricardo, are we credited with medical coverage with a September 1st or October 1st due to a switch in coverage? Absolutely. So if you all switch to another carrier and they are, it's on a different renewal date, a different date, we will provide them with reports showing any portion of deductible that you have satisfied from January 1st of this year up through August 31st of the year, and you do receive credit for that.
Great questions.
Mm-hmm. Anything else? Any other questions? If Russ Edwards were here, he'd be saying going once, going twice. So,
Well,
oh.
I do want to thank all of our Longhorns for their time. I know a lot of times we get to plug in later. So, and I know everybody's ready to enjoy our summer, especially our instructional staff whose summer break starts today. So I just want to keep a reminder out there that to look for the survey that will hit your employee email because we're looking for your voice in this process. This presentation will be posted on the benefits page under the business office department on our website. But you can always email benefits@CHISD with any of your questions. Kathy's, a big part of Kathy's job is connecting our employees with their benefits. And we have great partners at Higginbotham Public Sector that have really served our district well. So we just want to keep that connection going and make sure our employees have the most information that they can while they're informing their decisions. Oh, we got one more from Ms. McElroy.
Can you reiterate the idea of coinsurance and how it works? Absolutely. So the plans that have a coinsurance, once you meet your deductible, you're responsible for the first, depending on which plan you choose, you're responsible for that deductible. And then some of the plans have a coinsurance that comes behind that deductible, whether it's a 10% coinsurance. Some, if you're looking at other options, will be a 20% coinsurance. Some will be a 30% coinsurance. Where when you access care, you're then, after you meet your deductible, you're responsible for either that 10%, 20%, or 30% of those eligible charges up until you hit that listed out-of-pocket maximum. Once you have met that out-of-pocket maximum on those coinsurance benefits and deductible, then the plan begins paying at 100%. Ricardo, if we have a medical debit card or medical savings account, are we able to keep it even with switch in coverage to Blue Cross Blue Shield? Two different things. If you have a flexible spending account, then you can maintain that flexible spending account with any plan. If it's a health savings account, IRS guidelines dictate that you do have to be covered under a high deductible health plan to continue making contributions to your health savings account. Now, if you have a health savings account today and you're on a qualified high deductible health plan and you've been making contributions and you have that debit card and you want to switch to a non-qualified high deductible health plan, you're just no longer allowed to contribute to that health savings account anymore, but you can absolutely continue to use that debit card to pay those qualified medical expenses.
And I believe we're going to use the same administration, whether or not we are with the 90-degree benefit plan or Blue Cross Blue Shield. Is that correct, Christina? We weren't talking about changing who administers that.
That piece won't be interrupted, correct?
Yeah. So same debit card.
Good question.
All right. Well, I think we have wrapped up all the questions. Again, any kind of questions that come in after the fact, we'll also be happy to post under an FAQ sheet on our website. Thanks again for joining us, and we really appreciate your time. Thanks again to our partners at Higginbotham for spending this hour with us and our continued partnership.
Thanks y'all.